Hello, I'm Dr. Saurabh Joshi, and I'm going to talk about a venous ulcer. Now, what is a venous ulcer? And this is a technical term. We say that this may be a venous ulcer, may not be a venous ulcer. Is it an arterial ulcer? Is it a neuropathic ulcer? So, venous ulcer is a wound on the leg that is because of varicose veins. Okay. Now, typically, how do you come to know clinically whether this may be a venous ulcer or not? Now, even if you don't see large veins on the legs, if you have a wound that takes an abnormally long time to heal, usually if a person who's otherwise healthy gets a small wound on the leg, hand, anywhere, usually we see it healing within a day or maybe a week or so. But if you have a wound that stays, especially on the legs below the mid calf down towards the ankles, if you have a wound that is not healing for say more than 8-10 days, 2 weeks, or if it is healing, it tends to keep coming back again and again. And if you are beyond 50, then this is I mean, we should be very suspicious of this being a venous ulcer. And it is not necessary to see big bunches of veins to label it as a venous ulcer. We need to do an ultrasound scan to know the status of the veins, and then to tell you whether you have varicose veins or not. Is this a venous ulcer or not? Most patients uh, don't see these big bunches of veins on the legs, and that's why they are really confused that I don't see any veins. You're calling it a venous ulcer or varicose vein ulcer, but where are the varicose veins? So if you are on the heavier side, then these veins might be hidden underneath the soft tissues, and there might be straight veins which are large, which are, because they are a little bit deeper inside, you don't see it externally. If you have that skin darkening on the legs, if you have swelling on the legs, if you have a wound that doesn't heal properly, if you have the typical skin pigmentation of varicose veins, then it should be a very high suspicion of this being a venous ulcer or not. And so, how do we identify and what do we do about it? Once you think that okay, this might be a venous ulcer, what to do? Well, a doctor can see and sort of think about a possible cause of this being varicose veins. Once you think about it, you need to do an ultrasound examination, a color Doppler ultrasound examination. How to do that? There is a previous video which you can see how we do an ultrasound examination, how we find that you have varicose veins or not. Once that cause is found, it needs to be treated. Now, very often venous ulcers are infected. Infected means you have a wound, but you have an infection over it. And in addition to the wound, because of the infection, the wound becomes larger and larger and starts developing pus over it, and it becomes very painful. The skin around it becomes red. This would first require some kind, if it's a mild infection, then some oral antibiotics to treat, or if we find that it is grossly infected, then there might be a procedure called as a debridement, where we clean the upper layer of the wound by surgery and then do the varicose vein treatment. Now, how do we, okay, we do that, there's no infection, we did a blood test, we found that there's no infection, we can go in and do the treatment. So the treatment of a venous ulcer is is to treat the underlying varicose veins. Now, there are various ways of treating varicose veins. In the olden times, there were these open surgical procedures where we cut and removed the vein, or we stitched and sort of ligated or stripping procedures for the veins. But these had a high recurrence rate and required the patient to be made unconscious or given a spinal anesthesia to treat. And other than that, uh, this would require, some, because of the anesthesia, it would increase the anesthesia related risk. Most of our patients with venous ulcers are elderly, are beyond 50 years of age. They have other issues like blood pressure, diabetes, maybe some breathing issues, and they might not be ideal candidates for general anesthesia or spinal anesthesia. Now, those the open surgical procedures are a thing of the past. Then came the burning procedures, where we heated and burned the veins. So these are laser and radio frequency ablation. These we burn and shrink the vein from the inside. But when we are doing that, it would hurt. For it to not hurt, we have to make you unconscious or give a needle in the back, give a spinal anesthesia. And to protect the other tissues, we have to give this local anesthesia mixed with saline to infuse it all the way around the length of the vein, so that we are protecting the muscles and skin from burning. And what happens is, if we burn too close to a nerve, then that can cause a peripheral neuropathy. And in addition to that, it is difficult to do this under a venous ulcer. So right under a venous ulcer, if you're burning the vein, it would be difficult to give the perivenous tumescence, and injecting or putting a needle through an already open wound is extremely painful. Uh, and But that limits the treating part of the vein, which is right under the ulcer. Uh, in comparison to that, a non-thermal ablation technique, which is now a newer technique to treat it, because we don't use heat, we don't need to make you unconscious, we don't need to give a needle in the back, we don't need to give the perivenous tumescence, and it's a more assured closure of the veins. It can be done right under the ulcer. And we have our how do we do it, previous videos can be seen. We have techniques where we flip the device and treat. So instead of going down up, we go from the knee downwards to take the device right under the wound, so that we eliminate the venous stasis right from under the wound. These are techniques which can be done with relative comfort and much reduced anesthesia risk for the patient. And patients usually walk around the same day. Having said that, you still need to take care of your wound. You still need to maintain a hygienic environment, do the dressing as advised. Some patients who have very large wounds on the legs might need a skin graft procedure at some point of time. If we find that the wound is not closing as expected, or if it's a very large wound and it's going to take a long time for the wound to heal, we would advise you to see our plastic surgery colleagues and think about a possible skin graft procedure. So that was what about venous ulcers. And if you have any questions, please put them down in the comments below, and I would love to answer. Thank you.